your mask, to still social distance, wash your hands, take all the precautions. And, I know it's easy to, with school starting and football games, it's easy to think that we're sliding back into normalcy, which we are, but the mask works. And I think the mask is something important that we can't give up on the mask yet, and keep those masks on. For medical center, we've had 1,404 positive tests. Currently, we have 32 COVID patients in medical center. 21 of those patients are at 8 Central. 11 of those are in the CCU as well, with 5 of those on the ventilator. Our COVID patient list today includes 5 from Buena Vista and Odessa, 2 from Deerings in Odessa, 1 from Siena of Odessa, 1 from Focus Care of Odessa, 4 patients from Ector County Hospital, and 1 from Monahans, 1 from Alpine, and 1 from Andrews. So if you're keeping up with all that, 16 of our 32 patients are either from the nursing home or from out of town. On top of that, I just got an update. It looks like we're going to dismiss 5 of those today. So we have 32, we'll have 5 less this afternoon. We're going to send 5 home. That's good news, and we wish them the best and a continued recovery. So that's going to bring our number down even more. So 5 of those will go home today. We've had 5,067 negative tests with 22 tests pending. No suspected cases other than what we know of in-house. And we have tested a total of 6,490 people, 90 tests. So that number continues to grow. But the good news is, with everybody we have in here today, we're sending 5 home today. So we wish them well, and that will get our number right back where we like it in the 20s. So that'll be great. And all right, and I will send it over to Kristen and let her update y'all on a few other things we got going on. Kristen?
Yes, I just wanted to kind of give a little update on our emergency room. We've been working through an efficiency flow project with them, and they're doing some great things as far as movement down in there. So we're direct bedding a lot of all of our patients. Very little time, if any at all, is spent in the waiting room now. We went live on this project a couple of weeks ago, and so we're seeing a lot of good turnover times as far as the door to see a physician, the door to hit a bed, the door to go home. And so with that, our visitation team took the progress they've been making there and has decided that we're going to open up visitation for 1 visitor per patient in our emergency room now. This is going to start on Monday, so the 14th, at 7 o'clock in the morning. We'll start that visitation run. Now, the visitors are not going to be allowed in the waiting room. So if for some reason a patient has to wait in the waiting room, we'll ask the visitor to go back to their vehicle, provide us a good number so that we can call them. And then the minute a patient goes to the room, then that visitor can come in. It will be the 1 visitor. It won't be I'm going to stay 10 minutes and then swap out with somebody. It truly will just be the 1 visitor. Now, one thing we are doing is, because we have COVID and it's still alive and well along with any other disease in our emergency room, we have a release of liability that any visitor will fill out prior to going back into the patient room. And so we'll be keeping that on file as well. And anyone that is a COVID positive patient, they will not be allowed a visitor, just because we want to make sure that we're remaining very stringent in our COVID patients. Anyone that's a PUI, we're going to allow them to have a visitor. And then, of course, if we're having any kind of aerosolizing procedures, then they will not be able to be in the room. And then if they get admitted, of course, then they will have to exit the building as well. All visitors are going to be assigned a wristband. So once they are screened, they sign their release of liability, then they'll get a wristband so that our staff walking around the emergency room will know that they belong in a particular room. That's just another safety mechanism for us to be aware of who should be in the emergency room as we try to accommodate some visitors for everyone. Everyone will be allowed or must be required to wear a mask when they're in the building, same as what we have for the rest of the hospital. So we're going to encourage the public to bring a mask with them so that we make sure that everyone has a mask prior to the release, the wristband, and being entered into the emergency room. I think that is all for me, Russell. I think this is a good move in the direction. We know how important it is to have visitors. We know how much family members can contribute to the care of a patient. So I think this is a good step in the direction for the hospital as well as for the community.
Kristen, I just wanted to add one more thing too, is if those PUIs, even if the PUI test positive, the visitor you mentioned must leave, but parents of pediatric patients obviously can stay with their children. And
all of our restrictions will be the exact same. So those exceptions, your pediatrics, your moms in labor, those requiring that special need assistance, those will all still be in place.
Okay, just wanted to make that clear as well.
Yes, this is definitely a transition for everyone. There'll be some kinks, I'm sure, to work out beginning on Monday, but it's a good step in moving towards the hospital as a whole, transitioning to some type of visitation to get us back to some sense of normalcy with our patients.
You're on mute. You're on mute, Russell. Sorry.
One more thing I wanted to say, what Kristen, we're asking for everybody to be patient with us as we work this out. You know, we know when the patient comes in the emergency room, the family member, you know, they're a good source of history and what's going on with the patient and what the patient normally responds to and acts like. So we thought it was important to try to work that back in, and it's going to be a transition time back into it. So we need everybody just to be patient with us, to understand that we're trying to accommodate the patient and their families, and it's a big step to do that. This is not people back in the hospital, not up on the patient floors. This is a very small area that we're gonna try this out and see how it goes. But we think that it's important to start working our way back into that, and we just appreciate everybody's patience, and it's been tough. We understand that, you know, not being able to be in here with your family members and the regular patient floors and in the hospital is tough because people, you know, they heal faster and they just get more attention when their family is with them, and we understand that. And this is just our first step in trying to bring some of that back. So just hang with us, work with us, be patient with our staff. Those people in the emergency room are heroes. They've been after it since day one, and just to work with them and let us help you be with your family member and just be patient with us. So we just ask for that from the community.
Thanks, Russell. Dr. Sheridan, do you have the ORMC numbers?
Sure, Trevor, thank you. Would you also let me share my screen as I'm giving a little bit more info? So for ORMC so far, we've done 2,973 tests. 2,542 of those are negative, 431 are positive. There's no pending tests at this time. We do have a reasonably good supply of Cepheid PCR test kits. So for all of our inpatients, for all of our testing that is done in the hospital, we're doing all of those on the PCR machine ourselves rather than sending any of it out. The only tests that are being sent out now are the ones from the outpatient testing center for patients coming in just for the testing. So right now we have none pending. In our floors, we have a total of 10 patients. One of them is an OB patient. 9 of them are in the ICU, 2 people on ventilators. 7 of those people are local. 2 of them are from Big Spring, and 1 is from Reeves County Hospital. We've had only 1 discharge since yesterday, so kind of holding steady at that 10 patient number. Happy to see that overall our numbers have continued to remain somewhat stable. So I wanted to take the opportunity to share just a little bit of how we look compared to the rest of the country, or rest of the state, things like that. So this is our total number for the US, 6.4 million cases. And you can see the new cases over the last 14 days. This is the average of new cases over the last 14 days, somewhat stable. And as you come down, you'll see that the new cases over time, from day to day, has waxed and waned a little bit. The biggest spikes being the one that happened probably in early July, early to mid July. And you can see it's starting to stabilize out here. As we drill in a little bit more into Texas, you'll see the new case 14-day number sort of waxing and waning a lot more. And you'll see that we did not have the early spike like the rest of the US, but we just had that July spike here in Texas. The last thing we want to drill down into is our county, right? So when we drill down into our county, you'll see the waxing and waning of new cases is a lot more prevalent. And if you look at the dates on these rises, they are immediately post long weekends, holiday weekends. So that's what we want to look at, is each of these spikes and when they occurred. As you can see, over time, our new cases has stabilized. We're still having some new cases now, but a lot less than we were having earlier on, about a couple of months ago. So that's important data for us to look at. The one other thing that we look at is positivity rates. This is updated almost daily. These are states where the positivity rate is under 5%. That's when we consider it safe to sort of come off some of the precautions that we're taking and kind of tone it down. These states are the ones that are above 5%, and Texas is right here at 7.95. So let's just call it 8% positivity rate for Texas. Our Ector County positivity rate is closer to 14 or 15, so almost double the positivity rate of the state of Texas we have in our county, in Ector County. So it's important for us to know that information, because a positivity rate is the number of tests that are positive out of all the tests that were done. We haven't been doing less testing, we've been doing more testing. And if our positivity rate is rising, it means, if our positivity rate is high, it means a lot of people that are getting the tests are still testing positive. So it's important for us to keep in mind that this disease is still very much in our community. And as we start to make changes in our community, for example, schools opening in a phased fashion over time, bars opening up soon at some point in time, we have to be careful to watch this rate and make sure it doesn't climb too fast. As you know, vaccines are in clinical trials right now. There's about 38 vaccines or so that are in clinical trials in different phases. You know about the recent news from the phase 3 clinical trial, one of the vaccines from AstraZeneca that had some patient safety concerns, so they slowed down the clinical trial. So there's always going to be setbacks throughout those trials. We have to be careful in wanting a vaccine quickly, because vaccines are very important for safety of the general public. When we talk about emergency use authorizations that the FDA issues for medications to treat patients, we're talking about treating patients that are quite sick, and with this treatment, they could improve. So they have a short fuse or a lower threshold in approving emergency use authorization for a medication that could be potentially life-saving. When we talk about a vaccine, it's a little bit different, because you're giving it to the entire population, sick or not sick. In fact, you're giving it to more people that are not sick to prevent them from getting sick. So you definitely want safety in a vaccine to not be compromised. So quality and safety are going to be number one in vaccine development. And so as we look at emergency use authorizations that are going to come out for vaccines that are in development now, we don't want to rush the process, because we want it to be high quality and we want it to be very safe. I just wanted to end with that for now. Trevor, thank you.
Thank you, Dr. Saravanan. Mayor Turner, did you have an update before you get to media question?
Sure. First, I'd like to say the schools are doing a fabulous job. We're not seeing a lot of numbers I just want to thank the teachers, the administrators, the custodians, everyone that's doing such an amazing job. We are having our next 4 rounds of testing. It will start September 16th at McKinney Park. It will be just like the other testing. There will be 200 tests that are done. Start at 9 a.m. and end at 11. September 23rd will be at UTBB Park. It's the soccer fields, so if that helps. September 30th will be at Sherwood, and October 14th will be at Floyd Gwynn. So those testing are going to be free, just like the other ones were. So we encourage everyone that feels like it to need to go out to get tested. But that's all I've got, Trevor.
All right, thanks. Dr. Davenport, do you have anything to add before media?
Nothing right now. One of the things I want to just add on from Dr. Servan, he's talking about the lower positivity rate, and he said that things can start to loosen up. And I would echo what Russell said, is that doesn't mean stop wearing masks and stop social distancing. Even though the numbers may start to improve or we see some stabilization, I would echo, continue to wear your masks, continue to social distance, continue to wash your hands, and just be careful.
Thank you, Dr. Davenport. That is very important, especially right now. Let's go to Mike Merlot, Odessa American.
Hey, I'm okay today, Trevor. Thank you.
All right. Danny, you there? Do you have a question, sir?
I'm good too.
All right.
Good for me.
All right. Jared, you're good. I know William, good. So looks like Scott, you are up, sir.
Thank you, sir. Mr. Mayor, I just wanted, while I have you, and this is a tangent, the big state story today is defunding police departments, and the governor had his news conference last hour saying if you defund your police department, he won't allow cities to annex. I just wanted to get your opinion on defunding police while we have you on the line today, please.
Well, we're not working on any annexation, so it really wouldn't matter, but I'm not going to defund the police. I'm not going to cut the police budget. We stand behind our police officers. They have a very difficult job. All around the country, you see leaders that are not supporting them. I've always told them I've had your back, and I will stand side by side with you. I know they make mistakes, just like all of us do, but a lot of times they aren't publicized as much as the other mistakes we make. But I stand behind our police officers, and I feel almost positive that my council feels the exact same way.
That's perfect. Thank you. That's all I've got.
Well, that was quick. Anybody have anything else they'd like to add before we go? And if everybody's comfortable, we can just do this again next Thursday. Just keep it once a week for now and see how this plays out. Everybody good with that?
Yep.
Good.
All right. Russell, do you want to finish this out then?
I do. I saw this one this morning, and I thought it was appropriate. It comes to us from Isaiah 26:3 that says, "You will keep in perfect peace those whose minds are steadfast because they trust in you." And I think we all need some peace and comfort, and keep us focused on the good news and what the good Lord does for us. And he is the Prince of Peace. And that's all I have today. Have a good day.